Whenever a patient is signing up for surgery, they really have to be as best informed as they possibly can about the risks and benefits of the procedure. So in this video, we're going to talk about one of the worst things that could happen with a vaginoplasty, and it's the thing called a fistula. In this video, I'm going to explain in the simplest terms possible what that means. My name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon with a gender-affirming practice based here in Miami, Florida. And if you find these videos useful, please like and subscribe. Okay, so you may have heard the term fistula, and of course, as somebody who is not a doctor or surgeon, that can be really confusing, but basically, this is what it means in the simplest terms. So whenever we're creating the new vagina, there is limited real estate down there. So basically, we're making a new canal between Miss Prostate and where you pee from, the urinary tract above, and the rectum down below. So we have to very carefully create that new canal between these two structures. If there is injury to the urinary tract, that's usually not such a big deal, but if there is injury to where you poop from, that can be a problem. And the reason is, if we create a hole or an injury between the rectum, which stores the poop before it comes out, and the new vagina, the stool will preferentially come out the new vagina because it's a lower pressure area as compared to the anus, which is higher pressure down below. So the chances of this happening are about 3 to 5%, depending on the literature you read. A new study came out recently and quoted a 6% chance of this happening. So over about the 9 years or so that I've been doing this, touch wood, I haven't had any that I know of. And that's not to say I won't. One of my mentors says the only reason you don't get a complication is if you're not operating. So inevitably it will happen, but there are lots of steps we take during the surgery to try and prevent this. So why is this such a bad thing? So what we know is that when there is that abnormal communication and the stool can leak out the new vagina, sometimes the only way to fix it and to stop the stool continuously coming out is to divert it. And what I mean by that is a bag, so a colostomy bag. And so if that fistula or abnormal connection forms between the new vagina and the rectum, we may need to give the patient a temporary colostomy bag in order to let everything heal up down below and stop that constant flow of stool going down there. So I have taken care of patients who had a fistula from elsewhere and who had to have a colostomy bag, and it's really not as bad as I would have expected. So the one patient I can think of, she went about her usual activity, went back to work, and usually about 3 months later we can check and see is everything healed down below and reverse that bag so the patient poops from the normal way. Recreating the vagina can be challenging because things are scarred down there, and usually we would wait a bit before reattempting that, or maybe trying to reattempt it through different means. So that is the problem with the fistula. If it does happen, oftentimes it means 2, maybe 3 extra surgeries that we hadn't planned for. And a lot of my patients are young, healthy patients, and with their careers, and don't necessarily have time to sign up for that. Again, thankfully, it's pretty low. Chances, I would say, are approximately 4 to 5% chance of that happening. And before we do any surgery, we just need to be fully informed what we're signing up for. So hopefully that this video demystifies what that particular complication is.